What do you think are some of the key takeaways from this study?
We've done the study now for 18 years, and over that time period, we've definitely seen improvements in emergency preparedness efforts around the country, but we're still seeing very significant areas that are in need of improvement, and COVID-19 has just reinforced those.
What do you think kind of like stands out in terms of West Virginia's preparedness?
Well, what we did in terms of our looking state by state was identify 10 indicators that we think are good um, measures of whether states are fully prepared for all types of hazards. And we then divided the states into high, medium, and low based upon how well they did with those indicators. West Virginia came out in the low uh, area. And what we found there is not that there aren't good things in West Virginia. The health department there at the state level is doing a very strong job, and there are a number of very positive things that have been done. But there are some clear areas where attention would be called for and would make a difference.
What are some of the things that you would maybe recommend for West Virginia?
Well, one example is paid sick leave. What we found in looking at emergencies, including COVID, is that when workers have paid sick leave, they're much more likely not to come to work if they have an infectious disease. And if, unfortunately, if they have no paid sick leave, they're more likely to come, and that can lead to transmitting of illnesses and significant problems for the workers themselves. So about 55% of the people in West Virginia have paid sick leave, almost half do not. Another example is seasonal flu vaccination. That is a measure for how well a state is prepared to undertake vaccination in a widespread manner. And there, only about half of the people that are recommended to receive the seasonal flu vaccine in West Virginia actually do. So those are two areas where strengthening those policies would be good preparations for future emergencies.
I noticed that there's a lot of sort of like, I guess, states that connect to West Virginia, or I guess you could maybe just say Appalachian states that are in the lower tier. Do you think that, why do you think that might be?
One indicator that is extremely important in terms of measuring the level of preparedness in a state is how much support, how much investment there is in the public health system at both the local and the state level. There have been a number of studies that have shown very clearly that the more that there is an investment in public health, the better the health of the population in general, but also the better prepared the population is in the event of an emergency. So some of the states that surround West Virginia and West Virginia itself are at a rather low end of the investment in their own public health systems. So we think recognizing how important those systems are, making sure they have the resources to do the day in, day out work, epidemiology, laboratory capacity, communicating with the public. If those resources increase, then the public's health is likely to increase as well.
hmm I know that one thing that was kind of discussed in the study was just the differences between sort of the federal role in things and the state role, and sort of what each one has to bring to the table. Can you talk a little bit about that?
Yes, there's certainly in emergencies, there's a role for both state and federal, and in addition to that, for local as well. Um, the the historical way that a major emergency like COVID has been handled within the country is to have clear, consistent direction from the federal government that then is adopted at the state level with adaptation to the local conditions. We didn't have that with COVID. And so as a result, we've got 50 different approaches with different policies. And we're seeing that now in who's being prioritized for vaccination. I think that the evidence from past emergencies is that consistency is good. Having states and the federal government work in partnership absolutely is important. But if there is unevenness in the response, it makes it difficult to have the most effective policies in place.
And some of that might have to do with also the sort of misinformation that has been in the public sphere in the past year, you think?
It's certainly true that um, the most effective way to combat an infectious disease outbreak is to utilize the people who have expertise in emergency response, infectious disease experts and emergency preparedness experts. They're familiar with the science, with the facts, what will work, what won't work. And unfortunately, there was a gap at times between what the science experts would say and what elected officials would say. Now, I've been in public health for a few decades, and I've overseen a number of emergencies, and there's always some degree of difference between the elected officials and public health officials. That's normal and understandable. But as much as possible, you want to strive for alignment so that the steps necessary to combat what can be a life-threatening illness are taken based upon what we know from the facts, and then they don't become overly politicized.
hmm I think we might have touched on this, but do you think that the stats this year were surprising at all, or do you think that they were kind of like on target with what you thought they might be?
I think that we have seen these trends over the last several years that would lead us to believe that the survey this year was not that surprising. What we do hope is that COVID really changes things because it's been a wake-up call to a lot of people that what we have done so far, our underinvestment in emergency preparedness and public health, has placed us in a vulnerable position. So we're hoping that this year becomes a turning point and that next year we see quite significant change in terms of these measures. Just one example of that is around a paid sick leave, where Congress actually passed a law early in the pandemic response saying paid sick leave has to be covered for people who have COVID or who have been exposed to COVID. And I think that was a recognition that that there is a strong relationship between socioeconomics and combating an emergency.
Okay. Is there anything that I didn't ask that you wanted to touch upon or anything like that?
Well, one lesson that we've also been reminded of this year is that while emergencies like COVID can affect everyone, there really is a disproportionate impact, a heavier burden that affects certain populations. And we've seen that with populations of color. We've seen that with lower income families. We've seen that with older adults. So we have to recognize, I think, that in all those examples, there are underlying reasons that make people more vulnerable that are really beyond their control, having to do with whether they have to go into work when everyone else is teleworking, and whether they have paid sick leave, whether or not they have easy access to healthcare or they feel like there are barriers to healthcare. So we also feel like focusing on equity, focusing on fairness is a lesson that we've learned again in COVID. And we're hoping that that will result in policymakers paying more attention to guaranteeing that everybody has access to the public health system and the healthcare system, regardless of the color of their skin, regardless of their income.